welcome to News 9 Digital. I'm Pratibha. Thank you for joining me live today. Did you know that 70% of COVID positive patients do not infect even a single person, while the rest are responsible for spreading coronavirus to 5 to 6 or even more people? And this is how it spread so rapidly in India. A new study that is based on tracing more than 3 million contacts in Andhra Pradesh as well as Tamil Nadu is the first major study of transmission done outside China, United States and Europe. And it is the largest study as well to date of how COVID-19 spreads through communities. This study has examined data from over 5,75,000 individuals in India who were tested after coming into contact with over 84,000 infected people. This data shows that just 8% of COVID-19 patients account for 60% of the new infections. This means that this small percentage is responsible for the massive spread that took place across the country for the virus. The results of this study are quite significant as well, because it shows that there is only a 1 in 40 chance of catching the virus from someone in the community who wasn't a household member. And there have been already several perplexing qualities of coronavirus that have surprised even researchers. And one of them has been on the unique ways in which it affects other people, and this study attempts to answer that and much more. To tell us more about the details of the study, Dr. Ramana Laxminarayan, the director of the Washington-based Center for Disease Dynamics, who led the study, joins us live. Doctor, many thanks for joining us. Doctor,
thanks for having me.
If you could just, firstly, of course, tell us about the research that you've conducted. It shows, of course, the catastrophic danger that is posed by a few super spreaders.
Right. So this study, as you mentioned, is based on 80,000 primary index cases and then 575,000 contacts. And as you said, about something like 29% or 30% of the primary infecteds were responsible for all of the secondary infections. But what is more, 8% of those who were infected were responsible for 60% of all the, the secondary infections, which means that a small proportion are spreading more than others. Now, what does this really mean? It means that, certainly we don't know who those people are. There's no way to identify them at this point in time.
Okay.
So anyone who's COVID infected is actually, a person who can potentially give you the infection, and some people are more able to shed the virus, and therefore they're able to transmit the infection compared to others. Some people also have the opportunity to do it. So, for instance, we found that if you're traveling on a bus or train, sitting within 3 rows of a person who is COVID positive and sitting there for 6 hours or more, that there is a almost 80% chance of contracting the virus. Now, of course, the sample size for some of these conclusions is slightly smaller, but still it seems to be that traveling together over long periods of time does pose a risk. Similarly, there is evidence that being in the same household is only about a 1 in 10 risk of COVID, and we see that also in China and South Korea, that there are very similar results out of there as well. So 1 in 10 chance of contracting it, someone in your house if they happen to have COVID. And let me also add that this is not the largest study outside of China or Europe or the US. This is the largest study in the world. It's bigger than anything that was done in these countries. And in fact, the largest study out of China is a study of 100 primary cases and 200 contacts. And ours is 80,000 primary cases and 575,000 contacts. So this is the most conclusive evidence, regardless of which country it's being performed.
Absolutely. So kudos to you for that, because this is extremely significant. As well as the days pass by, we're learning a lot more about coronavirus and its spread as well. But Dr. Ramanan, if you can tell us, in your study, what are the factors for such rapid spread from some infected people? Are there any biological factors? Are some people, especially efficient at spreading the virus? Or is it only the environmental factors that were studied?
We don't actually know. It is probably a combination of what we call host factors, characteristics of the individual, but also characteristics of the circumstance. If one person happens to be in a in a market with many other people, then they have a chance to spread to many people.
Hmm.
It is a combination of these two that makes super spreading, and we don't know from our study what is making this possible.
Okay.
But super spreading is been known in many other diseases, so it is not surprising for COVID. But it is the first time we have nailed it down as happening in the case of COVID anywhere in the world. I think people have thought this is probably happening, but this is it's good to have the data to show that it is actually happening.
Absolutely. So travel in close proximity, what you found, carries the highest risk. But one of the other most worrying results of the study are that children play a very significant role in the spread of the virus, transmissions being the highest in children aged 5 to 17. So now with the schools reopening in the new phase of unlock, would you say it's a catastrophe waiting to happen?
See, again, the way science works is that one study doesn't prove everything. This is one study.
Okay.
It is a large study, but it's still one study. And science works on replicability, which is if you find that in other situations. Previously, people had concluded that children likely don't play a role in COVID transmission. And what we're saying here is there's a good chance that they're wrong. And children in our study seem to play a role. Although the number of children in our data set was obviously smaller than for the adults, but still we found that children are both good at receiving COVID, getting infected, but also at transmitting COVID.
Okay.
So what I would say is at this stage, we cannot rule out the importance of children in transmission. And certainly reopening schools does increase the likelihood of transmission. We've seen that in other countries, like in the United States, in Israel, for instance. Israel had to go into a second lockdown because they opened all their schools and their COVID cases started rising. So I think we're seeing circumstantial evidence from other countries as well about the role of children. But I think this is something to definitely watch out for when reopening schools.
Absolutely, and tread with caution as well. But you know, Dr. Ramanan, what is the bearing that the study will have on spread of coronavirus as we know it and the policy changes that are required? Is it possible to stop super spreader, a scenario where one person is infecting many people? Because you also said that we can't really identify a super spreader. So we can't really say who is that one person who's going to spread it to many people and who are the others who might not spread it to as many people. So, to deal with this situation, would you say some policy changes are required, like perhaps delaying the opening of schools and ensuring that long travel, public travel is also halted for a while?
So I would say that that may not be the most actionable part of what we find.
Okay.
I think the more actionable part of what we find is really on the mortality. We find that, in fact, the case fatality ratios, which is the proportion of people who are tested positive for COVID who then go on to die, that proportion is highest in India between the age of 40 and 70 compared to countries like Italy, Brazil, China, and the United States.
Okay.
Now, why might that be the case? That is because we have a lot of undetected diabetes and hypertension. In fact, 45% of those who died in our sample were diabetic as well. And it's possible that even more might have been diabetic that were undetected. So I think that, we have policy recommendations which are to identify people with comorbidities because, such a large proportion has comorbidities when they die, to be able to bring them into hospital and get them tested very quickly. What we see, for instance, is that the median time to death, which means half of the people who died within the first 6 days of being admitted.
Okay.
And compare that with the US, where that number is more like 13 days, and similarly for China, which is over 2 weeks. So clearly, the people who are infected are dying faster in India.
Okay.
For reasons, again, that we can only guess at. But it certainly means that early testing is really going to be a best way to control the epidemic and to prevent deaths. So I would say the one actionable thing out of this is, to increase testing, to increase RT-PCR testing.
Okay.
The rapid antigen test does throw up a lot of false negatives. People who might have the disease, but the test says no, they don't have the disease. So I would say actionably, the testing increase is really what one should really focus on.
Okay, all right. So, Dr. Ramana Laxminarayan, many thanks for joining us and sharing these insights, and congratulations to you for the study, the research that has been conducted as well. Like the doctor said, it's impossible to always determine who might be a super spreader, but there are factors at play that greatly increase the threat, and perhaps we can control these factors as much as we can. Whether or not there are any policy changes, this study gives us ample information about the precautions that we can take. We can never really know who a super spreader is. So it's best to ensure that we wear face masks anytime we're outside, ensure physical distancing and maintain personal hygiene. Long journeys in public transport to be avoided, and be especially careful with kids, because kids now seem at a higher risk of not just contracting but also spreading the virus. Thank you so much for joining me live today. I hope you like the information that we shared with you. I look forward to your comments on the subject. Thank you for watching. Take care.